Hello everyone, I'm Moy, and welcome to Massage Therapy. Today, let's dive into the sternocleidomastoid muscle, or SCM. It's a mouthful, but an important one. The SCM is that ropey muscle on the side of your neck that loves to complain when you're stressed or staring at your phone too long. It's responsible for turning your head, tilting it to the side, and even helping you nod yes. This muscle originates at the sternum and clavicle, hence the fancy name, and inserts just behind your ear on the mastoid process. Don't forget to subscribe to keep your patient's muscles happy and healthy. To identify the SCM, start by gently turning your patient's head. Visualize a line running from the mastoid process behind their ear to the sternum at the base of their neck. Ask your patient to lift their head slightly off the table or resist gentle downward pressure. The SCM will activate and shoot up, clearly marking itself along that line. Once visible, you can confidently palpate and assess the muscle. Start by warming up the SCM with gentle thumb circles at its insertion point, the mastoid process just behind the ear. Use light pressure and slow, soothing movements to relax the tissue. Gradually follow the muscle down its length with your thumbs, maintaining those circular motions until you reach its origins at the sternum and clavicle. This prepares the muscle for deeper work while keeping your patient comfortable and relaxed. Begin with the patient's head in a neutral position, as the SCM has more give this way. Using your index and middle fingers, gently clamp the muscle from both sides, ensuring you're only grasping the SCM. Apply light, comfortable pressure and create small, alternating circles as you work your way along the length of the muscle. It's easier to perform this technique in the middle of the SCM, as the areas near its origin, sternum and clavicle, are more challenging to access. For an alternative approach, use gentle back and forth movements to address the posterior side of the muscle. Always direct your pressure away from the neck to avoid compressing the carotid artery, which lies just beneath the SCM. Keep your movements controlled and check in with your patient to ensure they feel comfortable throughout the technique. Let's talk about the pinch and lift technique. Start near the insertion at the mastoid process. Using your thumb and the inside edge of your index finger, gently clamp the muscle like you're grabbing a stuffed animal in a claw machine, but with more precision. Slowly lift the muscle up and away from the neck, then gradually release the pressure as your fingers meet. Be careful not to pinch the skin. This is about isolating the muscle, not causing discomfort. Keep your contact broad by using the pads of your fingers instead of the tips. This avoids sharp pinpoint pressure and keeps the experience smooth and effective for your patient. Take your time and remember to check in with them for feedback. Let's move on to the active pin and stretch. This technique focuses on the origins of the SCM, which are located on the sternum and clavicle. Start by using the pads of your fingers to apply broad pressure directly on these bony landmarks. Don't dig in, just place your fingers gently but firmly to anchor the muscle. Now, ask your patient to rotate their head as far away from the pressure as possible. This lengthens the SCM, creating a great stretch. Before you do that though, try to pull a bit of slack on the skin, so you have opposing forces. This gives you better leverage to make the stretch more effective. The SCM plays a key role in turning and tilting the head. It's one of the main muscles that allows you to look over your shoulder, so when it's tight, it can limit mobility. Take it slow, check in with your patient, and remember, broad pressure and smooth movements will always serve you well. What the heck is Gua Sha anyway? It's a traditional healing technique where we use a smooth-edged tool, often made of jade, bone, or quartz, to gently scrape across the skin. The goal? To release muscle tension, boost blood circulation, and kickstart the body's natural healing process. It's simple, effective, and a great addition to your massage toolkit. Start by gripping the tool at a 30 to 45 degree angle to the skin. I like to begin at the insertion of the muscle, focusing on the muscle itself, not the bony landmarks. Think of it like peeling a sticker off a surface. You're trying to get under it, not just scrape the top. Gently scrape the tool in short, controlled strokes along the muscle, applying firm but comfortable pressure. As you move down the SCM, keep an eye on your left hand. It's acting as an indicator of the medial edge of the SCM, guiding you on where to stop and helping you avoid injury. Once you reach the end of the muscle, don't forget to address the origins at the sternum and clavicle as well, using a scooping motion. You can also flatten the tool a bit to include some of the anterior fibers of the trapezius for a fuller release. Remember, consistency is key, so keep the stroke smooth and steady, and always check in with your patient. Last but not least, let's dive into the paint scraper technique. Yeah, you heard me right, the paint scraper. Turn the tool onto its side using the long concave part. Place it snugly under the lateral edge of the SCM and use a scooping motion to lift the tissue. As you do this, you can use your index finger on the opposite hand to mimic the tool's motion, creating a flat, long edge with your finger. Move both together to gently lift the tissue and enhance the release. Remember, less is more. You don't need a lot of pressure, especially in this sensitive area. Always be mindful of the bony landmarks and work with caution. A lighter touch will still bring great results without overloading the area. Keep it smooth, controlled, and patient-centered. Alright, that's a wrap for today's video. If you found this helpful, don't forget to subscribe and give that like button a little tapotement. It really helps the channel grow. And remember, life's a lot like a paint scraper. Sometimes we need to gently lift the layers of stress and tension to reveal a smoother, clearer version of ourselves. Take it one scrape at a time, and things will get better. Thanks for watching, and I'll see you next time.